I'll do that kind of filling space and chatting a bit until I get everybody in the back there. I mean, obviously I can shout louder, to be fair. And those that know me well know that's true. Is that better? Yes, that's better. We have a thumbs up at the back, which is always good. Good afternoon, I'll say it again, everybody. I love that bit, though. I love the noise and chatter of all of us together in the dental world. It's such an important thing. And we're a small band of important people. And we're here, obviously, to celebrate the 47th National Smile Month launch. So thank you very much for making the time in your day and taking the time in your day to come. I'm Mary Coxon. I'm the President of the Oral Health Foundation and Chair of the Trustees Board. So I represent our trustees, and several of who are here today. I might wave at you later so you can come and chat to them. And we are really looking forward to National Smile Month, which is always such a success. The National Smile Month this year, sorry, glasses have to go on, it's that age. National Smile Month this year is running under the theme of Brush for Better Health. Yeah? And you're like, well, that's quite obvious, yeah, surely, Brush for Better Health. And it is for these people in this room, but actually when we look at it statistically, most people are brushing once a day, so over half of the population is only brushing once a day. And quite often that's in the morning, not in the evening. And almost nobody, apart from the people in this room, which obviously all of you are, is brushing for 2 minutes. Because 2 minutes is an eternity when you're trying to get ready for work or go to bed. And so we have a real problem with just the basics. And that basic of brushing is the cornerstone of better oral hygiene, of that prevention routine that we have at home. So that's what we're going to focus on here throughout National Smile Month. But we'll build on that foundation and talk about, complete oral care, and oral care and oral awareness. And obviously, once they get that brushing in there and that twice a day with a fluoride toothpaste, then we can build on it with interdental cleaning, we can build on it with mouthwash, and we can build on it with different ways of neutralising, like chewing gum, and making sure I'm mentioning all of our sponsors today there too. But don't just take my word for it. So the Department of Health, or OHID as I think it's now called, I was lucky enough to be part of the group that was looking at the science behind the Better Oral Health Toolkit and how we might bring that out into population. So it's a really strong scientific paper. It's had lots of rigour attached to it, but unfortunately it's a scientific paper. So you need to get that plain language out there, and that's something that the Oral Health Foundation is fantastic at. Don't forget that the average reading age for something to really be digestible is age 9. So let's not, seriously, age 9, if you want it to be digestible for the public, don't be appalled, age 9. But that's half the problem. We flower things up in fanciness because we feel we should, because I'm a professional, but it doesn't really matter. If you can simplify it and talk about brushing, the movement, and really help people understand, you can make such a difference in their lives. And that's really what National Smile Month is about this time around. Every year, we're really thrilled to welcome all of you because this launch really helps springboard the campaign and bring it into life. And you sharing with everyone makes a big difference. Our sponsors taking part in organisations, in consumer healthcare, in retail, and then most importantly, those people in dental practice and community who are going out to the coalface and making a difference with those people. So we're delighted to have you all here to launch. There's going to be a few talks happening as well. And really what we want you to do is think about how you can make a difference and help amplify the National Smile Month there as well. I'm going to come back at the end and say a final few words, but I'm conscious that I'm not the main act. So I'm going to hand over to one of the main acts, which is the Oral Health Foundation's Chief Executive, Dr. Nigel Carter, OBE.
Thanks, Mary. I'm not sure that I'm one of the main acts either. I'd like to add my welcome to everybody here. It's great to see so many people here at this event, and it really does feel like the first post-COVID Smile Month launch that we've had. We had a great event last year, but a limited number of people. People were still a little bit scared about moving out and socialising, so this is absolutely fantastic. Some of you have been enjoying wine beforehand, and we've got some refreshments afterwards. I'd like to specifically thank the Wrigley Oral Health Programme and Johnson & Johnson Listerine for sponsoring today's launch event. Later on, you'll be hearing from Jean Duke at Mars Wrigley and Benjamin Tai speaking on behalf of J&J. As Mari said, 47 years, and many of you have heard me say before that I was there at the beginning. I'm getting as old as Methuselah now. But I won't talk about the origins of National Smile Month this year, but another little interesting fact that actually today we are sited next door to the first head office of the Oral Health Foundation, or as it then was, the British Dental Health Foundation, which actually had an office in the back room of Jack Manning's practice next door in Harcourt House. Unfortunately, one, it was Jack Manning's practice and we didn't own it, because the apartments in there are now going for upwards of £8 million. So if you've got £8 million to spare, you might end up living in the home of the original office of the Oral Health Foundation. Now, Jack was a pioneer. He was one of the early private practice periodontists. He was passionate about prevention, and really that's where the Oral Health Foundation came from. This background that we had in the UK of appalling oral health, where from the 1968 Adult Dental Health Survey, 38% of the population over the age of 16, and you have to think about that twice, had no teeth at all. So the foundation has always been about promoting oral health and promoting the value of a healthy smile and the fact that teeth should be for life. Now, most people now will recognise that they're not expecting to lose their teeth and be going around with nice new sets of NHS dentures. But there's still a long way that we can go in terms of oral health prevention. As Mari was saying, the habits that we do. We've been doing a separate piece of work over the last couple of years, building up to what we hope is going to be a major campaign to change people's view around their oral health and their habits. I think if you ask most people who's responsible for your oral health, they would immediately say the dentist. They're lucky if they're there 2 days a year now. And it's not a day, it's a 20-minute or a half-hour appointment. How can we possibly say that the dentist looks after our oral health? So we need to change that attitude from the dental practice being the repair shop and move it towards being the supporter of your oral health journey. Another interesting fact, and Tim, who's going to succeed Mari at the end of the year as our next president, says this is well established in psychological research. It takes 66 days to form a habit. 66 days. How do we think 2 20-minute appointments with a hygienist are actually going to do that? We've got the means available these days through a digital approach to actually keep nudging, helping people along that patient preventive journey. So let's get those who don't brush twice a day brushing twice a day. It offers huge potential for growth for the oral care companies who we're hoping will support the campaign. And really, this has got to be the way forward. We've got to change the attitude. We've made great strides together over the last 20 years, and twice daily brushing has in fact increased from 57% to 76%. But it still means that a quarter of the population are saying, oh, I've had a drink, I can't be bothered to do it before bed. I'm in a rush for work, I haven't got time to do it. And missing out that important oral care regime. So as we said, during National Smile Month, we'll be really focusing. Over the last couple of years, we've done a sort of 4-weekly campaign, and you saw that up there earlier on. And it's really focusing on getting people to realise what this oral care routine means to their oral health related quality of life. So demonstrating the daily routine, what might be added in terms of interdental cleaning, mouthwash, sugar-free gum, changing the diet, looking at a low sugar diet, and obviously the importance of regular dental visits to give that extra bit of support. We think the key to this, and maybe changing people's behaviour, is the increasing focus that we've got around systemic links, particularly in relation to gum disease. Been a huge increase in people's awareness of fitness as a result of COVID. You weren't going to do so well if you weren't keeping fit. So let's link that in and get that benefit through to oral health as well. Also important to start to look at sustainability and advances in technology, whether it's mobile apps, power toothbrushes, to improve that compliance and education for the patient. But Smile Month is about having fun. We interface on an annual basis with almost 5,000 different practices and organisations across the country who carry those messages out there into the community. For dental teams, it can be quite isolating being shut in a dental surgery every day just with your dental nurse for company and the patient coming in who of course can't talk because we've got things in their mouth. So the opportunity to actually go out there to campaign for oral health, to open the doors of the practice, have practice open days, is really important. So the campaign is for everybody. There'll be hundreds of events up and down in the country, some in practices, some in local communities, and a huge amount of media activity supported by a national media campaign that we'll be doing. And of course, no campaign these days would be successful without the digital approach, and we'll be promoting that very strongly during the campaign. This all couldn't happen without the support of our very loyal corporate supporters for the campaign, including Oral-B, Align Technology, Haleon, Johnson & Johnson and the Wrigley Oral Healthcare Programme. And a special mention this year for Boots joining us as sponsor for the first time this year, the first time we've had a major retail sponsor getting heavily involved. So great thanks to Helen Borton-Jones and her team. In fact, they launched National Smile Month yesterday in Boots head office in Nottingham and had 2-hour queues to actually visit the events and the stores that were going on there. We've got excellent programs with all the partners this year, and we'll be sharing these through you as the campaign goes on. So I think you've probably heard quite enough from me, and it gives me pleasure to hand over to Jean Jukes from Wrigley Oral Healthcare Programme, who is going to now talk to us.
Hi, good afternoon. Thank you, Nigel and Mary. I'm definitely not billing myself as the main act, so I'll be passing that baton on pretty quickly after a few remarks. Just to introduce myself, I'm Dean Duke and I'm from the Wrigley Oral Healthcare Programme. It's my first National Smile Month, so thank you to everyone for making me feel so welcome already. But I think on behalf of the programme, we're proud that this is our 10th year, I believe, of sponsoring National Smile Month. So I'm thrilled to be taking all the credit and moving our partnership into a second decade as well today. For anyone who doesn't know about the programme, we support dentists in engaging with their patients to promote better oral health, specifically around the use of sugar-free chewing gum, as of course as part of a wider oral health routine, as we've been talking about already this afternoon. We fund independent clinical research, we develop materials for dentists to share with their patients, and we deliver continuous professional development as well for dentists. I think just thinking a little bit about this year's National Smile Month and where we are with dentistry in this country, And I say this as a relative newcomer to this space. I think the conversation around dental services has never really been louder in the public consciousness or the political consciousness. I think we all know that people are struggling to register with dentists. They're struggling to get appointments, whether that's for urgent work or routine checkups. And depressingly, people are struggling to pay for dental work during a cost of living crisis. And I think we in this room all know the problems that that's potentially storing up for another day. So it's with all of these kind of challenges in mind that this year for National Smile Month, we have commissioned research from Frontier Economics to better understand the potential impact that a series of preventative policies could have in promoting better oral health. And as you'd expect, chewing gum is in the mix there, but we looked at a few other areas as well. So we looked at water fluoridation, which, you know, as a policy would require capital investment by the government. And I think the government is looking a bit more closely at this now than it has for some time. Chewing gum obviously is something that people can decide to do for themselves, and there is a cost to the individual in deciding to do that. It's only about £55 a year, but that's, you know, more accessible for some people than others. And we looked as well at a programme of supervised brushing for children between 3 and 6 years old in the poorest 20% local authority areas in the country. So just those three policies, and you'll be relieved to know I'm not going to talk you through all of them. We'll be launching our report over the course of National Smile Month, and we'll certainly be promoting it far and wide, so we encourage everyone here to have a look at it when it's out in full. But just to speak to the potential role for chewing sugar-free gum alone for a moment, Frontier Economics modelling has suggested that could deliver 109,000 fewer tooth extractions every year on the NHS if people chewed 3 pieces of sugar-free gum a day after eating and drinking, and of course, you know, still brushing their teeth and going to see their dentists in line with recommended guidelines. There'd be 180,000 fewer fillings every year and 36,000 fewer root canal treatments. So, you know, we're going from 3 pieces of gum a day to some really impactful and powerful figures. And what that means potentially for NHS dental services is savings of almost £8 million. So that's quite significant and quite powerful as something that we can all kind of promote the adoption of as services face increased strain. And if £8 million was reinvested back into services, we could use that money to deliver almost 1.3 million additional appointments every year for the people who need them. As I say, the report in full will follow, but just looking at the potential impact of the 3 preventative policies that we've modelled, so fluoridation, sugar-free gum and supervised brushing across England and Wales, we could be looking at 1.5 million fewer tooth extractions every single year on the NHS, and overall savings of over £50 million to NHS services. So, you know, this is quite significant. And I spoke about the cost of living crisis. There's obviously a cost to individuals in terms of having to get, you know, urgent treatment, going for more routine checkups than might otherwise be required. And so we looked as well to the savings that individuals could accrue every year if we rolled out these 3 preventative policies. And it's £95 million that the England and Welsh population could save based on those 3 policies alone. So I think, you know, at the stage where we're at in terms of delivery and cost of living, I think these figures are worth looking at, and I hope that policymakers will be considering them. And, you know, I'm conscious we're preaching to the converted today. We all understand the role of prevention in promoting better oral health and health more widely. If the average age of reading age of the public is 9, I'm not sure what it is for politicians, but for our part, we'll be taking the report into Westminster and Whitehall over the course of National Smile Month and beyond. And yeah, I hope that everyone else will do so. Obviously, sugar-free gum is what we'll be talking most about, but I think there'll be something in there for everyone. So thank you again for having me. Really thrilled to be here again. And I think I'm handing over to Dr. Ben Atkins on behalf of Johnson & Johnson.
A quick programme update. Handing over to Benjamin Tye. I'm not sure whether we call you Johnson & Johnson or Kenvue now, but Listerine for sure.
Thank you, and I'm definitely not a doctor, just to clarify. Can I use this one, is that okay?
It's not,
Yeah.
It's not very loud, then you better all...
I'll shout. Can everyone hear me okay? Are we good? No? Can everyone hear me now? Oh, no. I might just use that one. That's okay, right, let's just go for it. So, first of all, I'd just like to thank Johnson & Johnson for inviting me here to speak on National Smile Month 2023. Happy National Smile Month, everyone. It's such an important cause. We're all very passionate about oral health in this room. So yeah, what I would like to do is talk about week 2, which is the daily routine. In particular, discovering habits, okay, and developing those healthy habits. Before I start, go to multitask, there we go. So my name is Benjamin Tai. I am a practicing dental therapist. So I work in private practice and work in NHS practice, and I'm utilising my full scope. So I'm really in the coal face of dentistry at the moment. I am also a tutor at the Eastman Dental Hospital, where we see a huge kind of diverse patient base. And I'm lucky enough to work across primary, secondary and tertiary care. So I'm seeing a variety of different people. I really like this quote by Stephen Covey, begin with the end in mind. Because when we see our patients, if they have oral disease, then in our head, we always want to get them healthy straight away. We want to overwhelm them almost with everything that we want them to do. But in reality, it's not always doable. I think Nigel said that it takes 66 days to form a habit. So where do I begin? We begin with true prevention, and true prevention starts with better plaque management. And we need to be tailoring our oral health advice to those individuals, and it's got to be bespoke to that individual. This might include the use of chemotherapeutics as an adjunct to mechanical cleaning. And this is even more important for those patients who are susceptible to periodontitis. We've all had those patients, I'm sure everyone's had those patients, in the room where you've got a patient comes in, mouth full of plaque, not one drop of blood, yeah? There's no inflammation in our mouth. And we've also had those patients who do everything. They've got the rainbow of tippies, they've got their interspace brush, floss, they're still bleeding, okay? They've got very different needs. So our advice needs to be tailored to that individual. I want to just discuss this document. So this is the current state of our nation. This is the Adult Oral Health Report. I say current, it's obviously not current, but we're expecting the next one imminently. So I'm going to talk about this one for now. Within that slice of our nation, which is a representative slice of kind of what we're seeing, we have 75% of adults clean their teeth twice a day. 75%. Doesn't say they do it well, but 75% attempt to clean their teeth twice a day. We have 66% had visible plaque. So we expect almost that of those 66%, some of them will have inflammation. And 54% of them had inflammation, gingival bleeding, okay? So 54% of those patients surveyed, which is a representation of our nation, had oral disease, because effectively gingival bleeding is oral disease, gingivitis. I suspect the next oral health survey, dental health survey, will be a lot worse for a variety of factors: cost of living crisis, access to NHS care, or restricted access to NHS care, and COVID. It's got a big impact on oral health. So this is a quote from Van der Weegen, I just want to get that right. Use of a toothbrush is almost universal, but the majority of the population do not clean thoroughly enough to prevent plaque accumulation. Basically, the habit's ingrained in us, or in many of us, 75% of us, doing it twice a day, but we haven't really got a clue what we're doing. We're just doing it, okay? So it's a habit, but it's definitely not a healthy one. Because if there's plaque accumulation there, it's not a healthy habit. We're not removing the thing that's causing disease. And we see things like this. So this is someone that I saw in practice, just a young guy, but brushing his teeth twice a day, yeah? As soon as you disclose, you can see all the biofilm that's left there. So it's not effectively removing that biofilm. We have some key recommendations from BSP and EFP. Brushing, let's just start with the basics, yeah? Let's try and get the brushing right. Doing that will reduce plaque accumulation by 42%. So it's a big chunk of biofilm. Then what we're doing, once that patient's fully engaged with brushing, is we add other things in, floss, interdental brushes. Again, we'll drive down this biofilm. But if we include chemotherapeutics into the routine, then it'll significantly reduce biofilm within the mouth. If we use chemotherapeutics, we'll reduce the thickness of the biofilm, so brushing and interdental cleaning will be much more efficient. And we have some SME guidelines, so a very succinct summary here, but a group of experts reviewed the evidence, looked at environmental factors, economic factors, also their own clinical judgments, and they came up with a framework of recommendations. You can just, I just want to draw your attention to the grade. So the grade O means that the grade's open. It's an open recommendation for you as a clinician. So if we look at electric toothbrushes, it's open, yeah? We don't have to recommend an electric toothbrush. Most of us will, because we know it's less technique sensitive, but we don't have to. You can't do just as good a job with a manual toothbrush if you are taught the correct techniques. Now the next recommendation, which antiseptic is the most effective in mouth rinses? So the expert opinion and evidence is now strong enough to say grade B, okay? That's the expert saying we suggest you recommend it to those patients who are susceptible to periodontal disease or periodontal inflammation, okay? It's a suggestion. The evidence to support that is Figueroa, and she tells us that after 3 months of continuous use, it's more effective than chlorhexidine, but you're just not going to have the same taste disturbances. So, addressing concerns. I know Prof. Chappell was here last year and he discussed the spit dud rinse thing in quite some length, so I'm going to glide over that. But I want to talk about biofilm. You can't address perio without addressing caries. You can't address caries without addressing perio, because it's biofilm driven. It's the biofilm which is causing the disease. So what we need to do is address the biofilm. In most cases, you reduce the biofilm and you reduce the disease. Okay? Biofilm is what the patient can do at home. Reduce that. So I want to go back to the daily routine. Daily chemotherapeutics to thin the biofilm, make it easier for the patients to remove it, achieve better outcomes. If you achieve better outcomes, you're going to get a reduction in inflammation, reduction in disease. So you're going to keep that motivation for that patient. Patients are going to be far more engaged with your advice. Therefore, you will develop a much longer, healthy habit. Thank you very much.
I think I'm back on. That's not back on. Sorry, I'll come and leave and hopefully it won't take noise. Thank you so much, Ben and Dean. Fantastic, and of course Nigel. I think we've had a good journey through a lot of different viewpoints about oral health and prevention. I probably just want to kind of pull some of that together. So try not to call it a chemotherapeutic adjunct to your patients, because they're not going to understand what that means. Average reading age of 9, so keep it simple, keep it clear in a language they can understand. I think everybody said start from a base of the basics and build up, and that way you're addressing every social economic situation and you're making an impact that's manageable for everybody. But also informed choice is so important, and letting them know all the things they could use and letting them choose how they improve that oral health in a way that works for them, which is so important. So I can see all the smiling faces, I can see all the smileys too. We're going to move on to starting to enjoy the launch and enjoy connecting with each other. I think I mentioned to you that there are some trustees now, so I'm just going to ask them to put their hands up and wave, the trustees in the room. So we are the board, the governance for the Oral Health Foundation. If you want to find out a bit more about that, please come and talk to us. They did wave for long enough, even though they were extremely uncomfortable. They did it well. So well done guys for that. We've got some nice fun things happening. We've got a little bit more liquids, refreshments. We've got some nice food. We have an amazing chap who's doing caricatures, so make sure you get yourself there as well, because that could be fun. And my personal ask for you is in National Smile Month is you can all make a difference. You're not all dentally qualified, but you all have that prevention and passion and belief that we can make a difference. So make a difference this month, and everybody you talk to, smile at them, tell them they have a lovely smile, because who doesn't want to hear that? And then remind them that brushing twice a day for 2 minutes can really help them to keep that smile healthy too. Because think how many people you reach day to day and the impact that you could have. So that's my personal ask. And then of course, socials, Insta. Don't forget to take selfies today and hashtag Smile Month 2023 if you like. Sophie is here with the coolest camera I've ever seen, and she will be taking photos. It's got an even better thing than a gimbal. It's gimbal on steroids, yeah. So make sure you get your photos taken, and make sure you're part of our launch, because you are celebrities in your own right, and you can help spread the message, which we agree. Enjoy catching up with colleagues. And then just one more thing from me, a very, very personal thing. So Nigel and I catch up weekly. I'm coming to the end of my 2 years as president in December. As we've already mentioned, Professor Tim Newton is president-elect and will be taking over from us. So that's the first one where we should have a little round of applause for that. And I couldn't be more delighted, really. And then the second thing when we were chatting yesterday is that I think this is one of the things I've stuck at longest in my life, because I'm 11 years into the Oral Health Foundation, and Nigel's been a huge part of that. And when we were talking, Nigel actually mentioned that this is his 25th year as the CEO. And it's hard when you're at the coalface and you're not seeing the numbers change to keep that passion. But I really have never met anyone with more passion, with more kindness. When people make idiotic comments, he's very good at smoothing it through. I've made a few in that decade. And he's taught me so much and kept me motivated as well. So I just wanted to recognise him at his quarter of a century. We're hoping he stays for another quarter too. But I thought we should really recognise Nigel and just say a big thank you. We will celebrate properly later immediately. That is me now, because you need to go and get some nibbles, because you've had wine and you're probably thinking, that was a lot of wine with no nibbles. So go and enjoy, take the selfies, spread the message. Thank you so much, all of you.
Not really.